Welcome back, everyone, to today's explainer. Every single morning we wake up, stumble into the bathroom, and look in the mirror. You see your face, your eyes, your skin. Most of the time we're just checking our hair or maybe making sure there's no spinach stuck in our teeth. But what if I told you that your everyday bathroom mirror isn't just a reflection of how you look? It's actually this fascinating biological dashboard. Think about it. The skin is the body's largest organ, and major internal players like the liver, kidneys, thyroid, and nervous system can completely change how it looks on the outside.
So what is your reflection actually trying to tell you? Imagine looking really closely at your face, your eyes, and your skin right now. Have you ever wondered what hidden internal clues your body might be leaving right there on the surface? Sometimes the human body literally writes its internal struggles directly on the outside for us to see. Today, we're going on an incredible visual journey through 20 medical conditions that leave visible clues right in your reflection. Now, just a quick reminder up front. This explainer is a guide to understanding these visual clues, definitely not a tool for self-diagnosis.
Okay, let's dive into this with Section 1. Reading the face. One of the most recognizable medical changes you can spot is jaundice, that distinct yellowing of the skin and the whites of the eyes. If you look closely at your eyes, they're normally white, or maybe slightly off-white, right? Well, when a substance called bilirubin builds up in the bloodstream, the eyes and skin can take on a very clear yellow tint. Bilirubin is basically just a byproduct produced when your body breaks down old red blood cells. In a normal, healthy system, your liver processes it and clears it right out. But if you have an issue with red blood cell breakdown, liver problems, or maybe bile duct disorders, that whole system backs up. The crucial takeaway here is that jaundice is a sign, not the disease itself. It's simply your body's way of saying the bilirubin system is completely overwhelmed.
Beyond just yellowing, your face's color and texture carry an absolute ton of information. A persistently red, flushed face? That might be whispering about rosacea, which is a chronic inflammatory skin condition. On the flip side, if you pull down your lower eyelid and it's unusually pale instead of a nice, healthy pink, that often shouts anemia, meaning your blood is lacking the healthy red blood cells needed to carry oxygen. What about symmetrical brown or gray patches? That could be melasma, a pigmentation disorder usually triggered by UV rays or hormonal shifts. And severe, deep, interconnected nodules point to acne conglobata, which is way beyond your average breakout. Now, while paleness or redness are really strong clues, they can have a bunch of completely harmless causes too, like simple sun exposure or just genetics, so seeing them doesn't automatically guarantee a specific diagnosis.
Now, what's really interesting here is the incredible contrast between two conditions driven by the exact same gland, hypothyroidism and Graves' disease. The thyroid is this tiny little gland in your neck, but it manages almost every major organ system. When it's underactive, that's hypothyroidism, your whole metabolism slows down. Your face might get puffy, your skin dries out, you're fatigued, and the outer edges of your eyebrows might literally even thin out. But if that exact same tiny gland becomes overactive, like in Graves' disease, your body goes into complete metabolic overdrive. The immune system actually affects the tissues around your eyes, making them look prominent or bulging, with retracted eyelids, plus you'll probably have a rapid heartbeat. It's totally wild how one tiny gland can change your facial appearance in completely opposite ways.
We've also got clues driven by inflammation and fluid dynamics. Take systemic lupus erythematosus, usually just called lupus. It's an autoimmune condition where the immune system mistakenly attacks the body's own healthy tissues. It famously shows up as a malar rash, which is this highly recognizable butterfly-shaped rash spreading right across the cheeks and the bridge of the nose. On the other hand, if you wake up with persistent puffy eyelids, this could be edema. Healthy kidneys are basically your body's fluid managers, constantly balancing water, salt, and proteins. When they become impaired, that fluid has to go somewhere, and it often accumulates in the facial tissues. So a biological imbalance turns into very visible swelling.
Hormones can completely reshape the face too. Cushing syndrome is a perfect example. It develops from prolonged exposure to excessive levels of cortisol. Now, cortisol is an essential stress hormone. We literally need it to survive. But when there's way too much of it circulating, it starts redistributing your body weight. People often develop a more rounded facial appearance, sometimes called a moon face, along with full cheeks, while their arms and legs might actually stay relatively thinner.
Moving right along to Section 2, Skin and Complexion Signals.
Check out these two dramatic pigment shifts. First up is vitiligo, where you see sharply defined depigmented white patches. This is an autoimmune condition, where the body literally attacks and loses its melanocytes. Those are the cells that actually produce melanin, your skin pigment. In total contrast, we have Addison's disease.
Biologically speaking, this is essentially the hormonal exact opposite of the Cushing syndrome we just talked about. In Addison's, the adrenal glands just aren't producing enough cortisol. That sudden drop triggers the body to crank up production of signaling hormones, which in turn supercharges melanin production. The end result? This unexplained darkening or hyperpigmentation, especially popping up in skin creases, on the knuckles, and around old scars.
And this next one brilliantly illustrates how your metabolism directly impacts your skin. Acanthosis nigricans. This is where areas in natural skin folds, think the back of the neck, armpits, or groin, develop this darker, thicker, almost velvety-looking skin. It's actually a huge, very visible clue for insulin resistance. When your body starts resisting insulin, your pancreas just pumps out more and more to try and compensate. Those chronically high insulin levels literally influence how your skin cells grow and pigment, causing that noticeable thickening and darkening over time.
It's so vital to realize that a rash isn't always just dry skin. See thick plaques with silvery scales? That could be psoriasis, which is driven by a trigger-happy immune system forcing skin cells to multiply incredibly rapidly. Red, cracked, persistently itchy skin? That's dermatitis, usually caused by a breakdown of the skin's protective barrier, letting irritants or allergens sneak in. Even diabetes can leave highly unique signatures right on the skin. Things like diabetic dermathy, which are these harmless light brown spots usually on the shins, or necrobiosis lipoidea, which shows up as yellowish or reddish-brown plaques on the lower legs. Basically, your skin is broadcasting your internal metabolic state for the whole world to see.
All right, Section 3, hands, nails, and lips. Let's look at the extremities.
Let's start with cyanosis, which is a bluish or grayish tint to the lips, tongue, or fingertips. It basically means there is inadequate oxygenated blood reaching those tissues. But hey, context is absolutely everything here. If you're out shoveling snow in the freezing cold without gloves and your fingers turn a little blue, your blood vessels are just constricting to save heat. That's totally normal and harmless. But if you suddenly develop persistent blue or gray lips while just sitting on your couch and you're having trouble catching your breath, no way. That is a medical emergency pointing straight to serious heart or lung issues. Did you know your fingernails are surprisingly accurate health monitors? Look at the extreme contrast between these two conditions. First, digital clubbing. This is when the fingertips become broader and more rounded, and the nails curve dramatically downward. We see this strongly associated with chronic lung or heart diseases where oxygenation is just persistently poor. Contrast that with koilonychia. Here, the nails become unusually thin and develop this concave, spoon-like shape, literally dipping in the center. That specific shape is a massive clue pointing straight to iron deficiency. Two completely different nail shapes, telling you entirely different stories about your heart, your lungs, and your diet.
And the localized clues just keep going. Have a finger that's swollen up entirely, looking kind of like a sausage digit? That's heavily associated with psoriatic arthritis. Notice unusually dark knuckles? That's occasionally linked to a vitamin B12 deficiency. What about angular cheilitis? Those super painful, cracked, inflamed corners of the mouth? Sometimes it's just saliva collecting there, but it can also be driven by fungal infections or, again, specific vitamin deficiencies. And if you open your mouth and notice your tongue is unusually smooth, red, and swollen, completely lacking its normal bumpy texture, that's called glossitis. Now, a dark knuckle or a smooth tongue definitely tells you something has changed, but remember, there are dozens of different things that could be the actual culprit.
Let's move on and see how this all builds together in Section 4, why context is everything. Take a look at spider angiomas. These are tiny red spots on the skin with small blood vessels radiating outward, so they literally look like tiny red spiders. Now, a few of these can pop up in perfectly healthy people, or very commonly during pregnancy. But if you start seeing multiple spider angiomas all over, that can be a neon warning sign for advanced liver disease. Why? Well, the liver plays a huge role in processing your hormones. When the liver starts failing, hormone metabolism completely changes, and that systemic hormonal shift literally paints tiny red vascular spiders onto your skin.
When you take a step back and look at the big picture, you realize that all 20 of these varied physical changes are driven by the same deep, interconnected internal networks. Hormones dictate the thickness and pigment of your skin and tissue. Blood disorders literally change the color of your skin and membranes. Chronic inflammation brings localized swelling and redness. Autoimmune diseases confuse your body into attacking its own healthy skin cells. And when major organs are impaired, whether it's the liver or the kidneys, internal substances and raw fluids accumulate and have to push outward. Your face and skin are really just a biological reflection of the engine running underneath. So the obvious question is, when should you actually pay attention? I absolutely do not want you running to the mirror every morning and panicking over every single harmless blemish, genetic quirk, or dry patch of skin. Most visible changes have incredibly mundane, harmless explanations. Maybe you just didn't get enough sleep, maybe you're a little dehydrated, or maybe you got a little too much sun over the weekend. But how do you know when it's time to actually pick up the phone and call a doctor?
Well, here are your exact morning criteria. You need to take a visual clue seriously when it crosses from a harmless quirk into these benchmarks. Ask yourself, is the change completely new? Is it persistent, refusing to go away after a few days? Is it rapidly progressing or spreading? Is it entirely unexplained by anything you've done recently? And most importantly, is it accompanied by other systemic symptoms? We're talking things like severe fatigue, pain, shortness of breath, or unexplained weight loss. If you have sudden blue lips paired with chest pain or persistent facial swelling right alongside chronic fatigue, that is for sure your cue to seek medical attention immediately.
So the crucial point here is understanding the diagnostic journey. Step 1 is the visible clue, what you spot in the mirror. But listen to me, you cannot jump from step 1 straight to step 4 on your own. Self-diagnosis is dangerous and highly inaccurate because, as we've seen, one single visual sign can have 50 totally different causes. Step 2 requires a medical professional to properly assess your history and other symptoms. Step 3 relies on actual concrete data, like blood tests and imaging. Only after all that can a doctor arrive at step 4, the actual medical diagnosis.
And that brings us to the end of our visual journey today. I want to leave you with this really powerful thought. The mirror may show you what you look like. Medicine helps explain why. Use your reflection to listen to your body's visual clues. Let it spark your curiosity and prompt you to take care of your amazing, interconnected biological systems. But always, always trust a medical professional to give you the final answer. So think about it. The next time you look in the bathroom mirror tomorrow morning, what hidden story will your reflection be telling you?